Good afternoon, everyone. Thanks for joining us for this Q2 news break. Montana Governor Steve Bullock once again set to address the state live this afternoon from Helena. We hear the governor is expected to announce new measures to provide relief to Montanans and ensure Montana hospitals remain open. We now go live to Governor Steve Bullock.
And I know I join many Montanans in sending our love and support to the family and friends of these Montanans. That's the other thing about Montana being one big community. We really are all in this together. I think it's important to recognize that no matter how challenging these days may be, we remember to look around and to see the good. It's important to remember that most people who have this disease actually have mild symptoms, enough to be able to recover at home. Of those COVID-19 positive cases in Montana thus far, 32 have been released from isolation and have recovered. This serves as a reminder that we will overcome these challenging times. And there are many Montanans who are working around the clock to ensure access to needed resources, to keep our families safe during this time. There are the grocery store employees who are working tirelessly to keep the shelves stocked. Truck drivers delivering supplies to fill those shelves. Gas station employees making sure that we have gas in our tanks. Teachers fulfilling that same dedication to providing a high quality education, doing so through creative means with distance learning. First responders working extra shifts to respond to the extra need. And there are Montana's health workers. Doctors, nurses, CNAs, pharmacists, and pharmacy techs, custodians, receptionists, and more, who fight COVID-19 while ensuring Montanans can access other essential medical care. It really does take all of us. And I'm humbled and inspired every day to see Montanans looking out for one another. As we continue to watch out for each other, it remains one of my top priorities certainly to find ways to ease the hardships on Montanans financially while we are in this state of emergency. As Montanans take seriously the responsibility to stay home to slow the spread of COVID-19, they shouldn't also have to worry about whether they can keep a roof over their heads or if they'll have running water. They shouldn't have to worry about having the heat turned off if they can't pay the rent or make their monthly utility bill. Today I'm issuing a directive that prohibits landlords from evicting tenants from their homes who cannot pay the rent during the stay-at-home order. It also prohibits late fees or other penalties due to late or non-payment of rent during the stay-at-home order. This directive also stops residential foreclosures due to non-payment for the duration of the stay-at-home order. Now, let me be clear, this directive, it's not a free pass on rent or on home debt. Tenants and homeowners still need to meet their obligations and should do so on time where they can. But so long as this virus forces Montanans to stay home to save lives, Montanans need a home to stay in. That also means providing for essential utilities that allow Montanans to remain safely in their homes. Montanans and Montana businesses take care of one another. So many Montana businesses have already stepped up on this front, and I want to especially commend them and their work and their dedication to all of our communities. Even before this directive, every single provider of electricity in Montana, including Northwestern Energy, MDU, and every single electric co-op or cooperative, they had agreed to voluntarily stop service disconnections for the duration of the COVID emergency. Water providers are stepping up too, voluntarily suspending disconnects as well. And our internet companies, which are so vital now that kids are at home for distance learning, they're also stepping up and suspending service disconnections. In line with that leadership from private industry, the directive prevents, or prohibits rather, suspension of utilities during the emergency including electricity, gas, sewage disposal, water, telephone or internet services, and it also prohibits late fees for bills due to the directive. This is a common sense measure that reflects how our communities really have come together. States across the country, red and blue, like Indiana and Iowa and Arizona, they've all done the same to protect their citizens. Well, we're asking Montanans to stay home to stop the spread of this virus. Montanans need to know that we got their back. Additionally, today I issued a directive that allows Montana hospitals and related facilities to receive financing to remain open and acquire supplies needed to respond to COVID-19. This directive will allow healthcare, medical, and related facilities to receive financing under the Montana Facility Finance Authority Act for operating expenses connected to COVID-19. Montana health facilities have lost revenues due to delayed non-critical procedures or from working to acquire supplies. Rural hospitals have been particularly impacted. While the federal stimulus package or the CARES Act will provide for support for operating expenses, that funding will likely take time. Allowing this financing will provide an immediate need for healthcare facilities to purchase supplies, pay staff, and remain open. For weeks, both rural and urban hospitals have served on the front lines of this crisis, and they need our support to continue protecting Montanans. Also of note, yesterday I directed that travelers arriving from another state or country to Montana for non-work related purposes undergo a 14-day self-quarantine. The directive applies to both Montana residents and non-residents entering our state for non-work related purposes. While Montana and Montanans, we love our visitors, we are directing that they not come visit while we're watching out for one another by staying at home. This action is warranted both to protect our healthcare system and to protect against community spread of COVID-19. The Montana Department of Commerce will be advising vacation listing and rental sites that they must notify potential out-of-state renters of this quarantine requirement. I've also authorized the National Guard to conduct temperature checks in Montana's major airports and major rail stations. They'll also be screening for potential exposure history for travelers arriving in Montana from another state or country at our airports. This is a significant and serious thing to do, and it's the right thing to do for all travelers in protection of the greater good of Montanans. I'd also like to share that it was, I guess, last Friday when the first 2-week closure statewide of our schools had expired, and all 400 of Montana's school districts have submitted plans, and those plans have been reviewed. The plans inform how they're implementing ways to provide students with quality public education through remote learning, how they're providing school meals, services to students with disabilities, and other services customarily provided to students in schools. As a governor and as a parent of 3 school-aged children, I'm so pleased that our school administrators and our teachers have shown incredible leadership during these unprecedented times. They've acclimated quickly to a new way of supporting students and staff, and collectively have ensured that students are able to receive a quality education and the services Montanans rely on during school closures through April 10th or longer, if indeed necessary. As such, I will be waiving the pupil instruction time requirements through the time of the directive of April 10th for all school districts, and districts will continue to receive state funding during this time. Now, as many of you know, for the past several weeks I've participated in a weekly or sometimes twice weekly call with other governors around the country and with Vice President Pence and senior administration officials, and sometimes the president. Yesterday, someone released portions of that call where I raised concerns with supplies, both PPE and testing on that call. As governor, it's my priority to make sure that Montanans' concerns are being heard and addressed. The purpose of these calls really is for governors to raise concerns in order to find solutions. No matter a rural or an urban state, all governors face many of the same challenges with COVID-19, and that includes ensuring adequate supplies, whether at our healthcare facilities, for our first responders, or for testing. We have been fortunate thus far in Montana that our state labs have been able to perform tests on all of the tests it receives with a pretty darn quick turnaround. But I do continue to have concerns that if the national supply chain were to fall through, even for one day, that we'd fall behind in our ability to test the current intake that we have. And as I've also said before, I continue to have concerns about the availability of the supplies to conduct the testing and those supplies like swabs and reagents. I don't want a day to go by without being able to perform tests. I'd also like to be able to make testing further available so that we can contact and trace, particularly in our harder hit communities like Gallatin County, so that we can aggressively be working in partnership with local public health to prevent this virus from spreading. So I'll certainly continue standing up for Montanans to ensure that we receive more hospitals, supplies, and testing supplies. And that means continue to work with our federal partners and private partners to access these resources. And it's something that we're doing pretty much on a daily basis. So to all the journalists, thanks for all your work. And thank you to all Montanans all across our state who are taking this period of a stay-at-home directive seriously. We can slow the spread of COVID-19. Thanks again. I'll open it up for questions from members of the media. Those of you on the phone, if you'd like to ask a question, you can press 5*. You'll be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask your question. If you raise your hand but have already received an answer to your question, you can lower it by also pressing 5*.
First phone question.
First phone question. Please go ahead if you're unmuted. Speak away.
Move on to the next one.
Go ahead, please. All of you could try talking once, and one of you are unmuted. I assume it's on. There's a little light. Okay, please.
With this announcement to provide this relief to people who are maybe renting these properties, do you also plan to provide some sort of support for landlords that will go without their source of income during these times?
Well, first and foremost, I hope that just about every renter does actually, if you can pay on time, pay on time. But when I have a directive of saying it's a stay-at-home order so that people need to be in homes, that the relief is waiving the penalties and interests on if one cannot pay rent. I'd strongly encourage everyone that can to pay rent, but there isn't anything in this directive that provides like state funding to those landlords.
Try another phone question.
Another phone question. I got a feeling. Well, please.
Governor John Amy with KX.
Yeah, John.
Obviously, you got a lot of national attention with the phone call with the president Can you tell us what you said to him, his reaction, and will you get any testing equipment?
Yeah, I mean, parts of that phone conversation was released and it wasn't released by me. So what hopefully you heard is continuing concerns. Look, on the one hand, it's and I've said this in these before, it's expected that we go through private supply chains to get the materials that we need, but often those private supply chains, either we are preempted, meaning that we'll place an order, that order will be canceled because either the federal government has requested those, or at times there's interstate competition going on. So expressed my concerns with the continuing supplies of both testing as well as PPE, and the equipment to keep our hospital workers and our first responders safe. And Dr. Fauci spoke a little bit about some of the things that we could do. Heard some good from the perspective of that there's some new faster testing coming from Abbott Labs, which Montana can expect, I'm not sure when, a number of those testing machines. But it's nothing that is unique in as much as that in one way or another, states all across the country have raised these concerns about supplies, including test kits, probably just about each and every call. On the phone. I can't, so why don't we put... Okay, go ahead, Holly.
Hey, I'm wondering what the state is doing to track compliance with the stay-at-home order, what sort of things you're looking at to see if people are following that rule.
So there's nothing at the state... Yeah, that's not going to work. There's nothing at the state level necessarily that, like, we're out there, but we know that, first of all, Montanans are complying to take care of one another, and it's something that local authorities, to the extent that there's concerns about businesses still operating or others, that local authorities do have enforcement authority. But this isn't about rounding up people, it's about Montanans taking care of one another in a time of what it really is a public health crisis.
To piggyback on his question, so obviously you mentioned in the phone call from President Trump that we're 1 day away from being without tests. So do we have tests right now in Montana? Are people being tested right now?
We do. We have 1,600 test kits available. The frustration has been, part of the frustration is that up through Thursday or Friday of last week, at most, we could order 600 tests that would cover 600 people a day. And, I mean, we have days where we run 500 tests, and we're running 500 tests through the state lab. Deliveries don't occur on Sunday. So that if we lost 1 day, or if all of a sudden we had a huge spike in testing, all of a sudden we'd start creating a significant backlog along the way. Raised concerns last week about it. We got, at least for now, an extra number of test kits. Had a call with the director of FEMA last Friday, expressing some of the concerns as well. This is something we're working on each and every day. But one thing that people should take from this, that we're working on each and every day, both through private supply chains and asking of the federal government to provide resources through FEMA and CDC, but also that in Montana, there has been no one turned away from tests because we don't have enough test kits. But we'll continue to be working because it is a daily basis to make sure not only that we have the test kits, but that we have the swabs. It was, I think, a week ago, Monday, or the week before, where all of a sudden one of our suppliers of swabs canceled our order because of the need for federal resources. So we either have to be able to get it from the private market or the federal government. We have to have supply chains for these materials. And something that is concerning to me, continues to be concerning to me, but instead of just being concerned on it, that we continue to find every avenue to do so. And also raise concerns from the federal authorities in as much as, and that's what that released part of that conversation was, is that far too often, I mean, I don't want us looking at, as a nation, when I'm asking so much of Montanans and Montana businesses, like, we got to make sure that the resources that we need are coming here, just like every other state needs to ensure that the resources that they need are coming there.
Another phone question.
Another phone question.
Hello, Eric Fisher with Montana Free Press. Repeat our question from last time. Do you have information at this point on where in the state people are being tested? And, for example, do we know with confidence that there aren't holes in rural communities where not people have been tested to be confident that the disease isn't there?
To be confident, well, anyone in an urban or rural community that shows symptoms of having COVID-19 and then is either traveled from an area of concern or had contact with someone that is COVID-19 is positive. Had late last week a call with all hospital administrators asking, and that's urban and rural, asking them if they had heard of situations where someone that is symptomatic with these indicia have not been being tested, and I haven't heard of anywhere to date.
Maybe a better way to phrase the question is, is the state doing proactive testing instead of waiting for patients to come in? Are you looking at doing like monitoring type testing anywhere?
To date, we are not going out and doing like testing of people that aren't symptomatic. No.
Thank you.
Another phone question.
Another phone question.
Governor Bullock, this is Nikki Willett from Yellowstone Public Radio. Thanks so much for holding the call. Can you help me picture the Montana National Guard's role in enforcing the quarantine
Sure.
of people coming into the state? Like, are they going to be able to detain someone who registers a fever?
No. So what will happen, Nikki, is that an airplane will unload. They will temperature check everyone coming off of that airplane, give them some information about the request for or the directive of a mandatory self-quarantine. To the extent that someone has a temperature, then that individual will be asked to then have an immediate consult with a doctor, and that'll be by telephone or by video. To the extent that they have a temperature, we'll also then provide that information after we make a request of where that they'll be sheltering for the next 2 weeks. We'll provide that information to local public health authorities to follow through. But no, the National Guard won't be, I haven't given them arrest power to do so. My expectation is that anybody that visits Montana acts just like Montanans are, and that we're courteous and we're neighborly and we actually listen to one another.
Another phone question.
Another phone question.
Hey, Governor, this is Holly. I'm wondering.
That was Governor Steve Bullock from Helena. Now the governor issuing another directive to Montanans to help ease the financial burden from the COVID-19 across our state. He's saying Montanans should not have to worry about being evicted or having their water or heat shut off. So this directive prohibits late fees for rent or bills. It also allows for no home foreclosure because of COVID-19. He says Montanans need a home to stay in. We now go to President Trump for his daily briefing in Washington.
Absolutely critical for the American people to follow the guidelines for the next 30 days It's a matter of life and death, frankly. It's a matter of life and death. I know our citizens will rise to the occasion, and they already have sacrificed a lot. We had the greatest economy in the history of our country. We had the greatest economy in the world. We had the best unemployment numbers and employment numbers that we've ever had by far. And in one instant, we said, we have no choice but to close it up. Just as Americans have always done, they will do a job like few have seen before, and they're proud to do it. I see that. There's a great pride going on right now. Before we hear from our experts, we have a few other announcements today. Today, the Treasury Department and Small Business Administration announced further details on the Paycheck Protection Program, which was made possible by the $2 trillion relief bill I signed into law last week. Nearly $350 billion in loans will soon be available through lending partners to help small businesses meet payroll and other expenses for up to 2 months. These loans will be forgiven as long as businesses keep paying their workers. This includes sole proprietors and independent contractors. Applications will be accepted starting this Friday, April 3rd. So on Friday, April 3rd, that's when it begins. Earlier today, I spoke with leading internet and phone providers who are doing a tremendous job of keeping our internet and lines of communication flowing under very strongly increased strain. The business is more than anybody's seen before because everyone's inside. They're all making calls. Among the leaders I spoke to were Hans Vestberg of Verizon Communications, Randall Stevenson of AT&T, Mike Sievert of T-Mobile, Thomas Rutledge of Charter Communications, Brian Roberts of Comcast, John Malone of Liberty Media, Dexter Goy of Altice, Michael Combs of Sprint, and Araya Borkoff of LionTree. Also, Pat Esser of Cox Communications and Jeffrey Story of CenturyLink. They're doing an incredible job. If you look at other continents, if you look at Europe, they went a different route than we did, and a much different route. We were talking about that just a little while ago. And they're having tremendous problems. Other countries are having problems. Other continents are having problems. But with business at a level that nobody's seen it before on the internet, it's holding up incredibly well. And they expect that to continue no matter what happened. And no matter how much more it gains, which if it can gain more than it already is, I don't know, because they're setting records. Let me also update you on the distribution of urgently needed resources and supplies. And we have a lot of numbers. I'm going to let Mike Pence speak to that in a little while. But we're giving massive amounts of medical equipment and supplies to the 50 states. We also are holding back quite a bit. We have almost 10,000 ventilators that we have ready to go. We have to hold them back because the surge is coming, and it's coming pretty strong. And we want to be able to immediately move it into place without going and taking it. So we're ready to go, and we've also distributed. I just spoke with Governor of Michigan, had a great conversation, and we sent a large number of ventilators to Michigan. We're sending them to Louisiana. We sent additional ventilators to New York, additional ventilators to New Jersey. And I will say in New York, FEMA is supplying 250 ambulances and 500 EMTs to help respond to the increasing caseload. That's a lot of ambulances. In California, the Army Corps of Engineers is developing 8 facilities to expand hospital capacity up to 50,000 beds, 50,000. And had a great conversation last night with Gavin Newsom. He's doing a really good job. We're in constant communications. The USNS Mercy hospital ship is now operational. It's in Los Angeles and receiving patients. And in New York, as you know, the Comfort, everybody watch that. It's in place and will be in a very short while receiving large numbers of patients, over 1,000 rooms and 12 operating rooms. FEMA has also provided 100 travel trailers to assist with housing needs, and we're ordering hundreds more. In Michigan, FEMA will soon deliver, in addition to the ventilators, 250-bed field hospital, and Army Corps of Engineers is evaluating locations to build alternate care facilities. So we're doing a field hospital in Michigan of 250 beds, and we may be doubling it up soon, depending on the need. They're doing a good job with beds in Michigan, but they may need more than the 250. So FEMA and the Army Corps of Engineers are prepared to go there quickly and get it done. In Louisiana, we're delivering 2 field hospitals to provide 500 new hospital beds. I've been talking with the governor, John Bell Edwards, and the Army Corps of Engineers has been really doing incredible work, establishing 3,000-bed alternate care site at the New Orleans Convention Center, which will be operational, believe it or not, this week. So we're doing a 3,000-bed alternate care site, and we're also doing a 500-bed new hospital. And that's in Louisiana, which really got hit. It started off very late, and it was looking good, and then all of a sudden it just reared up, came from nowhere. In addition to the supplies we're delivering, we're also giving hospitals the flexibility to use new facilities, including surgical care centers, to care for hospital patients who are not infected. For example, I know that many expectant mothers are understandably concerned about exposing their newborn babies to the virus, and they should be. With our action yesterday, hospitals now have the authority to create special areas for mothers to deliver their babies in a very safe and healthy environment, totally separate. Over the past 2 months, the U.S. State Department has organized one of the largest and most complex international evacuation operations in American history. Mike Pompeo has been working round the clock, along with Ambassador O'Brien. Since January 29th, we have successfully repatriated over 25,000 Americans from more than 50 countries where they were literally stuck, in some cases locked in. And I salute the incredible public servants at the Department of State, as well as their counterparts at DHS and HHS, who have played such an important role in doing this. You probably read about the young people in Peru and young people in Brazil, and they were absolutely stuck, and we got them out. Almost everybody is out now, back home with their parents, their wives, their husbands. I want every American to be prepared for the hard days that lie ahead. We're going to go through a very tough 2 weeks. And then hopefully, as the experts are predicting, as I think a lot of us are predicting after having studied it so hard, you're going to start seeing some real light at the end of the tunnel. But this is going to be a very painful, very, very painful 2 weeks. When you look and see at night the kind of death that's been caused by this invisible enemy, it's incredible. I was watching last night Governor Murphy of New Jersey say 29 people died today, meaning yesterday, and others talking about numbers far greater. But you get to know a state. I know New Jersey so well, and you hear 29 people, and hundreds in other locations, hundreds in other states. And this is going to be a rough 2 week period. As a nation, we face a difficult few weeks as we approach that really important day when we're going to see things get better all of a sudden. And it's going to be like a burst of light, I really think, and I hope. Our strength will be tested and our endurance will be tried. But America will answer with love and courage and ironclad resolve. This is the time for all Americans to come together and do our part I appreciate a lot of the media. We've had a lot of really good things said. I think only good things can be said when you look at the job that's been done. I just spoke with Franklin Graham, who's an extraordinary person, and Samaritan's Purse has been, like so many others, just been amazing and so fast. They did it so fast. He's been doing that for a long time, but I think people are really seeing what they have done. Franklin Graham, very special family. As we send plane loads of masks and gloves and supplies to the communities battling the plague, and that's what it is. This is a plague. We also send our prayers. We pray for the doctors and the nurses, for the paramedics and the truck drivers and the police officers and the sanitation workers, and above all, the people fighting for their lives in New York and all across our land. I watched as doctors and nurses went into a certain hospital in Elmhurst this morning. I know Elmhurst, Queens. I grew up right next to it. I know the hospital very well. Been seeing it all my life, my young life. And I will tell you that to see the scenes of trailers out there and what they're doing with those trailers, they're freezers, and nobody could even believe it. And I spoke to some of my friends. They can't believe what they're seeing. And I watched the doctors and the nurses walking into that hospital this morning. It's like military people going into battle, going into war. The bravery is incredible. And I just have to take my hat. I would take my hat. If I were wearing a hat, I'd rip that hat off so fast, and I would say, you people are just incredible. They really are. They're very brave. They're going in, and they don't know. You have lots of things flying around in the air. You don't know what you're touching. Is it safe? And you also see where you have friends that go into the hospital, and you say, how is he doing 2 days later? And they say, sir, he's unconscious, or he's in a coma. So things are happening that we've never seen before in this country. And with all of that being said, the country's come together like I've never seen it before. And we will prevail, we will win, and hopefully it will be in a relatively short period of time. With that, I'd like to ask Dr. Birx to come up and show you some of the latest, just the data that has been I think, brilliantly put together. And right after that, I'm going to ask Dr. Fauci to speak. And Mike Pence is going to give you some of the recent events that have taken place and some of the statistics that we have that I think will be very interesting here. Thank you very much. Please, Dr.
Thank you, Mr. President. If I can have the first slide, please. So always, and that's what this slide is labeled, is goals of community mitigation, really highlighting that this begins in the middle and the end with community. It is community and the community of the American people that are going to have to do the things for the next 30 days to make a difference. I think you know from that large blue mountain that you can see behind me, and I just want to thank the 5 or 6 international and domestic modelers from Harvard, from Columbia, from Northeastern, from Imperial, who helped us tremendously. It was their models that created the ability to see what these mitigations could do, how steeply they could depress the curve from that giant blue mountain down to that more stippled area. In their estimates, they had between 1.5 million and 2.2 million people in the United States succumbing to this virus without mitigation. Yet through their detailed studies and showing us what social distancing would do, what would happen if people stayed home, what would happen if people were careful every day to wash their hands and worry about touching their faces, that what an extraordinary thing this could be if every American followed these. And it takes us to that stippled mountain that's much lower, a hill actually, down to 100 to 200,000 deaths, which is still way too much. Next slide, please. Simultaneously, there was a modeler out of the University of Washington that modeled from cases up, utilizing the experience around the globe to really understand how this information that we have from Italy and Spain and South Korea and China could really help us give insight into the hospital needs, the ventilator needs, and really the number of people who potentially could succumb to this illness. It is this model that we are looking at now that provides us the most detail of the time course that is possible. But this model assumes full mitigation. It's informed every morning or every night by the reality on the ground coming in from New York, New Jersey, and around the United States, and is modeled and informed every morning so that it is adjusted so it is up to date every day.